Unacademy. Let's crack it.
Viewers, today with me I have Dr. Manish Talkar, who secured rank 117 in the recently concluded INI-CET. So he's joining with us to discuss his preparation strategies. I know that the next NEET PG is very near for all of you, so you may be quite confused about how to go about it. Now, Manish, having cracked that with a very single attempt, he may be the best guide for us to help us strategize our plan. So here is Dr. Manish Talkar. Hi, Manish. How have you
Hi,
been?
sir. Good afternoon.
Good afternoon. Okay, so our viewers may be particularly interested in knowing what worked well for you. Now, I know that you prepared really well, you put your hard efforts, but then obviously there may be some cheat codes and simple tactics that might have helped you to catapult your preparation. So, would you like to share them with our viewers?
Yes, sir. I actually started late after my internship in month of April, April,
Mhm.
May somewhat. So I had just initially planned that within 3 months, is it am I capable of cracking INI-CET of the May or July?
Yeah.
So I decided to give INI-CET of the November because I thought it's not possible for me within 3 months to crack that.
Yeah.
So, meanwhile, I get to know about Unacademy. I had other preparation sources also, but Dr. Zainab Bora ma'am, I watched her video and I totally surprised of the content that Unacademy has offered. And special thanks to the special classes that are conducted from the Unacademy. So I watched lots of special classes of Zainab Bora ma'am, Dr. Dilip sir, Preeti ma'am, Dr. Ranjit sir. They had amazing content within it. So we actually the Central Institute examinations. For that, we have to prepare one step ahead of the NEET.
True.
Okay, so we our preparation should be all of that level, not the usual level. So the content has to be also of that level only.
Yeah.
So I believed in an academy and I complemented my previous notes with it. And the content that I had today is so awesome that I can crack exam, any exam with that.
Yeah. See, one thing I appreciate in your strategy is that always plan well in ahead and know what time is available for you and what is practically possible from it. If you had followed that, if you had made an attempt to try cracking the previous INI-CET, then you would be in the second round of reading now, and both would not be ideally completed, right? Because you planned it well,
Yes.
so that you knew November is my target. That probably worked well for you. So I usually keep suggesting students that have a target in mind, and then whatever exams happen in between, use them as learning steps and don't take them as
Yes.
serious attempts. That is something that one
Yes.
should always keep in mind. Yeah, that's good that you're bringing it up for our students. Okay, so
Yes.
apart from the video lectures, like, did you really follow Harrison for medicine?
Yeah, I actually love medicine. So I read Harrison in my since end of the third year, in the final year, fourth year. I used to read the important topics which are quite important, like ACS or
Yeah,
some detailed topics. And usually I focused on tables more
yeah,
because that
true.
are more important. And reading the entire Harrison book is not that possible in 1 year period. So I had read much of tables and seen the volume 1, which is a concise version of the Harrison, and had lot of approaches to the patient. So I covered that in my final year, and I write that approaches in my way, that how I approach the patient if he or she comes to me. So whatever I had, and that I integrated in horizontal and vertical way, like with the other subjects that I had. And because patient will not come to you like I am OBGYN patient or I am medicine patient or surgery patient. So I
True.
had done it in that way.
Yeah, in fact, if you see all our questions also currently, whether it is INI-CET or NEET
Yes,
PG, they are also following a very similar approach. In the sense,
yes, yes.
if you literally remember the flowcharts in Harrison, then question which typically fits into a flowchart and it leaves you somewhere in the middle of the flowchart and it is
Yeah.
asking you to take a next step, right? So it's that definitely a good approach. I also keep telling all my students that flowcharts and tables in Harrison are like absolute
Yes.
gold mine. If I am an examiner creating MCQs, right, the first thing I will look for is go to a flowchart and dissect it and create an MCQ, or pick up a
Yes.
table and create an MCQ. So that holds good
Yes,
whether it is
definitely.
INI-CET or NEET PG. And once probably
Yes,
more full-fledged national exit test comes into picture, these kind of questions are going to increase in number. So,
yes,
I know Harrison is a very vast book. Apart from that, like every other subject has huge books. So for INI-CET, we all know that it needs little more extra preparation over and above what is required for NEET.
yes.
So from the very beginning, you're certain that you're going to aim for INI-CET, or you decided it towards the end of your preparation?
Actually, I had decided in my internship only, not also in the internship, I decided in my final year only I had to crack AIMS. But in the internship, due to COVID, I did not get a sufficient time to study. So I thought I'll do internship wholeheartedly and then I'll start at the end of the internship in April or May,
This
somewhat.
wholehearted involvement in internship, did it help you in your INI-CET exam?
Yes, actually, I got to know a lot of perspective of medicine in that, and got to do some procedures also like intubations or lumbar puncture, etc., which are commonly ward procedures and ICU procedures. And in COVID, lot of oxygen delivery systems, etc., get to see in practice how it works, ventilator approaches, etc. So my suggestion is that whatever you get to see in the internship, do see it and just complement it with some YouTube or whatever study material you have, and try to sink in with it.
Yeah,
That's it.
true, true. I definitely endorse this view. So, internship, if you're taking it seriously, right, you can try to read whatever you encountered, kind of cases and procedures and situations you encountered on a particular day before you go to bed. Even if you spend 10-15 minutes trying to read a little bit of glance through resources, either YouTube, Unacademy, textbooks, little bit of glancing through the resources, and that definitely cements your understanding of the topic. So that is one good point that you're telling.
And one thing is that lot of ward procedures which are conducted, the INICET tend to ask lots of questions from that. That is, in this exam, there is question on NG tube, how to insert that NG tube, etc. And even on questions on oxygen delivery system. So if you
As
do
basic
that,
as IV cannulas. Yeah.
IV cannulas, etc. So a lot of that questions come. So if you observe the word procedure and complement it with the right material, then you complete that there and there itself only. Because we know that we perform word procedure, but we forget what are the correct steps for performing that word procedure many a times, sometimes. And examiner tend to ask questions sometimes from that material only.
Yeah.
So
Uh, no, you had been on the Unacademy platform, and I'd been seeing you regularly visiting my classes.
yes.
Uh, Live classes. Right now in COVID, that was a bit of a difficult challenge for offline sessions to happen. So do you feel these live classes are going to helpful for students in connecting with the faculty members, or you feel them they are similar to the recorded versions?
Yes, live class one advantage is that you can ask doubt there and there itself if you have any, which is not there in the recorded class. Or in recorded class, what you do, you first read that class or attend that class and you post it somewhere on the Facebook and you get reply in some 2 to 3 days. So that the finished class on that day and getting reply on 3 to 4 days, the topic get wiped out most of the time. So that is one advantage of live class. And further, in many of the live classes, the tangential discussions also occur.
Yeah.
So related to the topics, and that gives a holistic idea for the class, for that topic, especially. And lot of other MCQs also discuss, which are not sometimes pertaining to that topic, but are important to know.
Yeah.
So that one advantage I consistently observe in the live classes, because I had attended lot of yours live classes also and Dr. Zainab ma'am live classes, Ranjit sir live classes, and lot of points I covered in my notes and added over there, which are not actually important to the topic, but essential for understanding the topic.
True. Yeah. Exactly. See, when you see questions, probably in the near future, the questions are also going to be more tangential than directly
Yes,
being very vertical. So if you don't have a holistic understanding of the topic, maybe that creates a bit of difficulty in
yes.
Exactly. And I think that is where the INI-CET sets the bar or the standard. Right.
Yes.
Coming to the question that would come from my students, right? If they have to aim for the next INI-CET, right? What would be your recommendations? Like they have few months
Uh,
left with them. So would you recommend them to go? See, let me talk about an average student who is not very well versed with the topic. Say, you assume that he has completed his MBBS, but otherwise he's kind of beginner. So what would be your recommendations for them? Like having gone through your experience, you have made it with a very great rank in very first attempt. So with your experience, what would you suggest them?
So first of all, whatever study material you have, that you stick to that study material, and you add points whenever you get time or whenever you are approaching a particular subject or approaching a particular video. Whatever extra material you get, you write in your notes. But make sure you complete your notes so that at the end you will get time to revise that note. Then don't revise from the videos, etc. And one special feature on an academy that there are a lot of before the exams a special series they conduct generally pertaining to the NICT questions related to particular topics. So what I had done that I watched that video and holistically a system or holistically a topic which is important for that gets covered over there. And I had that notes. I again seen whatever the point is not there. I write over there. So again, in the basics are much more important in the INI-CET because there are a lot of 50 to 70% questions which are there coming from the basic topics.
Yep.
So in the 6 to 8 month preparation, I had made sure that I complete the basics में राडा नहीं होना चाहिए कुछ. So
True.
I had made sure that whatever factual questions I used to leave because I don't like that factual questions. But अगर तुमने basics में screw कर दिया then rank काफी पीछे चला जाता है. So stick to the basics. Make sure you don't get any question wrong from that. Some topics are like in this examination there are topics remains the same, but the framing of questions and pattern थोड़ा सा alter हो जाता है. So if you have basics complete or knowledge of that topic complete, then yeah, getting the MCQ wrong is very rare in
Yeah.
that scenarios. And there are only 20 to 30% roughly topics which are important with respect to the INI-CET, but do that topic very well. So उसमें कुछ एक एक line particularly अच्छे से करना है. वो 20 to 30% topics में से.
See, now, after going through this INI-CET question paper, okay. See, now when we're taking classes for students, I see wide range of students. Someone who is just a beginner, and then someone who is like a kind of a pro who has also given exams. Now, where do you place a question which is very much based on a very recent updated research? For example, okay, there was one question about comparing the best treatment for cluster headache, acute attack, right? So there was one question. So their question was simplified. So probably we didn't need to bother too much about it. It was kind of straightforward. But if they had mentioned that there was both 10 to 12 liters of oxygen and sumatriptan parenteral as options given.
Yes.
Now that question PGI probably would have suggested it based on one of the recent study.
Yes.
So in that study, they had compared and they found that sumatriptan subcutaneous was superior to the inhaled oxygen at the standard dose of
Yes.
10 liters per minute. Now, those
Yes.
kind of questions, according to me, are very rare. Right? You will have only one or two
Yes.
questions which are based on some recent publications. So
Yes.
what would you recommend to students whether to run behind such questions and run behind journals or recent updates and attend a lot of recent updates class, or instead use that time for revising your basics when the exam is very near?
So I suggest you revise your basics. Recent updates are very rare to ask in the examination, and and there are lots of students who attend the examination. Hardly 5 to 5, not also 5 to 3% students are like that who might be knowing that. So अगर मेरा wrong आया तो there are lots of chances that किसी और बहुत जन का भी wrong होने का chances है. And our rank ultimately depends upon the student who had achieved first rank.
Yep.
So वो हिसाब से stick to the basics. Don't run much behind the recent updates. Yeah, they are important, but एकदम एग्जाम के फर्स्ट डे पहले या 2-3 दिन पहले आया हुआ recent updates very unlikely to get asked in the
Yeah.
exam. So you do recent updates which are released just 3 to 4 months behind, because there are highly likely chances that they might ask.
Yeah. Yeah, so this is one important topic. Even from my side, I would say all to all the students, don't run behind the journal articles or research publications. If at all you have to get some updates, mainly focus on there are some well-recognized professional bodies like American Diabetes Association or Indian Society of Critical Care Medicine. So if they have an update and that is released at least 1 to 1.5 months before your exam, and if there is a faculty who is summarizing it, maybe you can just go through that summary. Don't run behind the
Yes.
finest details. So finest details, trust me, I had been teaching NEET super specialty for most of the time. Very recently I've started teaching for NEET PG. So even in NEET super specialty, the finest details are not asked. Mostly the questions are from the superficial details of the recent update itself. So especially if you're targeting for INI-CET, don't run behind the journal articles. It is going to be a futile effort and it will consume a lot of energy. So as Manish pointed out, basics still remain the game changer. So if your basics are strong, you hold a pretty good stand. If your basics are weak, no matter whatever the top castles you have built, that you might have still chances of faltering in your exam. Okay, Manish, apart from that, okay, see now, me being a medicine person, like I will always get dragged to medicine, but how did you tackle other subjects? Like you have any particular suggestions for my students?
Yes, actually, I had done my notes first, and after that, I had watched Unacademy videos of Dr. Zainab Bora ma'am. She
Hmm.
had lot of videos covering majority of the
Yeah.
all subjects with great revision,
Yep.
with great points to get covered in the revision, and she has literally touched all the points.
Yep.
And then Dr. Ranjit sir for patho, I am a very huge fan of him. And Dr. Preeti ma'am, I
Yep.
watch her videos also, and she had made videos topic wise and discuss that topic in great detail. And she is mnemonic queen.
Yeah.
And again, Dr. Dilip sir, I had watched his lecture on stroke, and sir has covered it in great depth and in great details. And her MCQ and his MCQ discussion is also very nice. So, and yours lecture also I recently watched in covering in GI topics like GIT and the wide complex tachycardia. I literally fan of that lecture. It's though it's quite advanced, but I like that topic very well.
Yep.
And your lectures on oncology, etc., that topics oncology series, which is recently released, that also I had watched. It's very great.
Okay. So, pathology now, what percentage of questions were image based for you in the
Uh,
ICT?
Image based roughly there are a lot of questions in that, but that's from anatomy generally. For
Yeah.
20 30 to 40 rough of questions are image based in that. In this INI-CET, mainly focusing in electron microscopy from patho, and like electron microscopy is also the topic which is not covered usually in the general classes, but ultimately your basic sticks over there, and how you identify cells that matters in that particular seconds. So that, and then micro have and anat that are covered in image in this INI-CET most of.
Okay. One more strategy related question. Like, one way of dealing with pathology is just summing up all those named signs, named image findings on the slides, and all the named important tumor markers, and keeping that as your last revision point, or trying to be deep and have a integrated approach where you relate pathology with surgery or medicine and develop a conceptual understanding of that. So which one worked well for you, or which one you followed?
Actually, I followed second approach. I don't like to study much superficially. I had to, if I start a topic, then I should have that holistic understanding of that topic. So I'm preferred second approach. Actually, I studied Robbins in my second year also. That time it was I thought it was very boring book, but later when I studied Harrison's, At that time, I conjugated it with the Robins. So and highlighted much of important like genes, etc., from the Robins and pathogenesis, etc. So if you study Robins properly, then further understanding of surgery and medicine becomes good for you.
Yeah. If
And
when it, yeah. Yeah, go ahead, go ahead. Actually, when
yeah,
it comes to medicine, no, medicine is not a subject per se. It is just amalgamation of all the
yes,
information that you gather before you get into medicine. But medicine is
yes,
basically putting that into practice. Whatever you learn from pharmacology, pathology, physiology. So yes, if you have a conceptual understanding, then medicine becomes a cakewalk. I don't know about surgery right now, but I think medicine and pediatrics are very much conceptual. So if your
yes.
foundations are good from pharma, patho, and physio, and that, I think medicine is like just revising the whole thing that you learned in the previous years.
Yes, and in this INI-CET, I also felt that ki whatever you have learned in your all MBBS years, that doesn't go waste. You remember some or the other thing definitely in the examination hall
Yeah.
related to that topic. But the game is at how quick you remember that.
Yeah.
That is the game in deciding the rank. And mainly I focus during Robins in if you have less time, then focus more on the tables and the images of the Robins. So generally examiners ask questions from the tables and the images only most of the times from any standard book. So if you have less time, then do focus on the tables and images of that book. And you have a lot of faculties in the Unacademy, they had incorporated in their lectures the tables,
Yeah.
and that help. And you have PDF also of that available after the class, so I used to watch that PDF, some salient points, some important points of that. So that helped me again in covering a lot of topics in just small time period, and minimum of one to two revision that matters.
Yeah.
Not too much revision, more three, four, etc. That doesn't require, but it depends on how you covered your topics. But generally, I revise it one or twice only.
Okay. Having made own notes versus utilizing ready-made note, what worked well for you?
That again depends upon when you start. Actually, I doesn't like the prepared notes much. I used to like my own handwritten notes, but it doesn't matter. Ultimately, you have to complement it with your whatever materials extra that you get. And in short period of time, if you have ready-made or prepared note available, then go ahead with that. Actually, I had my previous notes available, so I didn't use the prepared notes much.
Okay. There was any hit that you could answer because you attended a particular rounds in your college or particular point was delivered to you during a case discussion and that came handy in your INI-CET exam.
Uh, one electron microscopy questions I got right because I watched an academic video of Preeti ma'am. She had covered the electron microscopy over there in great details. And again, recently, Dr. Ranjit also had covered the electron microscopy. So all those who are future aspirants must watch that video, because now there is trend of asking electron microscopy questions also. The lot of medicine questions I got correct because I watched an academy videos of Dr. Dilip and yours. Yours discussion was on that Corn syndrome, and because the question was on the Liddle syndrome, which was asked in the examination recently. And Dr. Zainab Vora ma'am's radiology, it all covered all the subjects.
Okay. Now, before we wind up, like, um, now I think you are trying to get into medicine. That is your
Max.
dream branch, right?
Yes.
Okay. So those who are aspiring to get into medicine and they want to target INI-CET as their first preference, maybe alternatively they will think of NEET PG. Right? Would you recommend them to spend more time with medicine or have balanced approach before you get into your medicine and learn medicine once you're inside it?
No, first you should have balance approach, because all questions wouldn't come from medicine. They cover a lot of questions from other subjects also, and especially don't ignore short subjects because they are scoring short subjects. Lot of questions they ask from the short subject, like roughly 20, 25, 30, up to 40 questions, they come from the short subjects usually. So if you get that questions right, then the game changes over there also much of the time. Then OBGYN and surgery also matters more.
The reason I asked you this question is because I do observe nowadays students say that if they like some particular subject, they are totally behind it, trying too deep, doing a deep dive into that subject. But usually there's a tendency that they may not be so good with the other subjects because they're behind one subject. So yeah, even I would
Sir, I
recommend.
would like to share one experience of mine with respect to that, because I also was like that only in my final year, because I like to study medicine a lot. And in that course only I ignored my surgery, and my surgery score came quite poor in the final year examination. So since then only I realized that to focus on all subjects in very balanced approach, then only you can crack any examination. Not only examination, but it's also required in general practice also to see the patients.
I see a lot of those kind of students these days. So that's why I wanted to bring it back. Okay. Now, one last question before we wind up.
Yes.
Did you write the NEET PG this time?
No,
Okay.
I
So
not written both of the exams.
okay. Now I just wanted to see where do you place the bar in comparison for the INI-CET in comparison to NEET PG, so that our students get an idea. If we are heading for NEET PG, this should be the level that we can expect, and if it is INI-CET, like this is 20% above that or 30% above that. Anyway, if you're not written, probably you might not have an idea
Yes.
what cocktail is happening in the NEET PG. But anyway, Manish, it was really good talking to you. I think whatever inputs you have given is going to help my students and whole Unacademy, or as such the whole medical fraternity, to have a balanced plan for the upcoming examination. So thank you humbly, thank you for from my student side as well as from the entire fraternity of Unacademy students as well as the faculty members. Humble thank you for you for taking time out. Now this is time for you to celebrate, so you have taken out some time to share with us. So I humbly thank you for that, and we will keep in touch. We'll keep in touch. The process of learning is just begin.
Yes,
We'll
sir.
be
Sure.
connecting soon again on other topics as required.
Yes, sir.
Thank you, thank you,
Thank you, sir.
thank you, thank you. Okay, I'll be winding up now, right? Okay, thank
Okay.
you. Thank you.